Good morning, everybody. I'm Dr. Indraneel Saha. I'm a consultant gastroenterologist practicing in the city of Kolkata for almost 19 years now. I did my graduation from Bardhaman Medical College and post-graduation and postdoctoral fellowship in gastroenterology from Manipal, KMC Manipal Academy of Higher Education. And I've been practicing in Calcutta from 2000 February. So I'm doing all gastroenterology practices, including hepatology, and my special interests are non-alcoholic fatty liver disease and endoscopic procedures like ERCPs and all sorts of endoscopic surgeries. Now, today's topic is very pertinent considering that we had World Hepatitis Day around 2-3 days back on Saturday, and liver is one of the most important organ in our human body, and the beauty of it is that you can keep your liver healthy provided you follow some basic guidelines and basic lifestyle. Now, as I told you initially, the commonest problem in today's world is non-alcoholic fatty liver disease. What is that? It is basically a disease of lifestyle, changing lifestyle. Nowadays, we are very, the most important problem in today's life is time. So in order to manage time, we compromise on our lifestyle. How? So remember the food first. Let's come to the food first. Previously, when we were young kids, remember, we used to have a lot of natural foods like vegetables, fish, chicken, and all those things. And our mothers and grandmothers used to cook at home. We used to procure these foods from the market, local market. And nowadays, we don't have time to prepare the food. So what we do is we buy off the shelf, the food from the shelf, pizzas or ready to cook food. We just pour hot water and the food is ready. Even leave about instant noodles, even the dal, chawal, pulao, biryani, everything is ready-made, available in packets. And we just buy it off the shelf, pour some hot water, and wow, the food is ready in 5 minutes. But these are all processed foods, including your sausages, the salamis, the processed meats, everything. So those things, they causes a severe problem with your liver if you take it continuously. Not only for your liver, in fact, the gut bacteria inside your intestine, that also gets modified, and that causes a host of a problem gradually. So what effect it happens? Gradually you gain weight, and that has an effect on the liver. Those processed foods are difficult for the liver to metabolize, and hence there is a pressure on the liver, and gradually the liver is damaged. Number one. Number two, we do not have time to exercise nowadays. People who exercise will be having a balanced lifestyle. But nowadays what happens? People have to get up from bed at 6:30 or 7 o'clock in the morning, grab some breakfast on the go to work, come back from office around about 9:30, 10, and they're dog tired to do any other physical activities. And again, the next day the ordeal starts. And on Sundays, you just catch up on your sleep or your rest or your household work, and you don't have time for exercises. So, but it is very important, not only for your heart, but also for your liver. You should exercise at least 30 to 45 minutes per day, at least 5 days a week. You might think that this is similar advice from a cardiologist. Yes, our body is not a government department that the labor department doesn't know, the finance department, what is the finance department doing, or the education department doesn't know what the other departments are doing. Every department in our body is very, very interlinked. So there is a very, very strong association between the liver disease, heart disease, your kidney disease, and all those things together. If those are damaged, we call it a metabolic syndrome. So gradually, if you don't exercise and if you have unhealthy food and lifestyle, what happens is your BMI, that is a body mass index, goes up. Now, body mass index is a ratio between your height and your weight. So there is an ideal body mass index. For the female, it is 24 to 25, and for the male, it is around 26 to 27. So if it's more than 30, you are considered as obesity. If it's more than 35, it's a morbid obesity. And if it's more than 40, you need a surgery, bariatric surgery for that. In fact, in the third world country, the commonest cause of surgery, commonest indication for surgery is a bariatric surgery. And we are pretty catching up with them. From a developing country, we are going to be a developed country maybe in a few years. And before we become a developed country, we are getting the vices of the developed countries. Now, number three, coming to number 3 point. When we usually go and try to relax, a lot of people, to get out of the stress, have alcohol, smoking. So those are detrimental. If you are a social drinker, maybe once or twice a month, that too in a limited quantity, enjoying with your friends, that's perfectly fine. But this social drinking sometimes become unsocial drinking. Like you are drinking twice or thrice or 4 times in a week. Might be at the end of your office work, might be with friends, might be even in a meeting if you're having a meeting with your clients and all. But remember, this is going to hamper your liver. Not only your liver, but also your other organs. So be very, very careful about controlling your drinking habits and your smoking habits. Smoking not only affects the lung or the heart, it also affects the liver. Even the blood vessels of your body, they get gradually thinned out if you have a prolonged smoking habit. So be very, very careful about your addictions. And this is number 3. Number 4 is you should go for a yearly checkup. Do a routine health checkup every year. If you find there is a increased SGPT and SGOT level, or your BMI is high, please see your doctor. Now coming to other liver diseases like hepatitis B and C, nowadays there is a lot of awareness campaign going on. Usually these are transmitted from an infected individual by way of body fluids. Now how does a body fluid transmit? It might be due to an infected razor, sharing a razor, or IV drug addicts, or if you have taken a blood transfusion during some surgery, or you have given blood for testing and that needle is infected, you do not know. So, and the symptoms for hepatitis B and C initially are very, very non-specific. You may not have any symptoms at all. There are a lot of times people come to us with very non-specific symptoms, or a routine checkup, like he is going for some surgery, and nowadays in any hospital, they do a routine screening for hepatitis B, C and HIV before you do any surgery, or even if you get admitted for a simple fever. And there are a lot of times that we see that the patient doesn't know. He is being given an application for a visa, and then the routine thing comes as hepatitis B or C positive. So what I mean to say is, my point is that there are no specific symptoms initially for hepatitis B and C. It might be a simple malaise, a simple weakness, tiredness, and then you investigate by yourself, you see an increased SGPT, SGOT or an LFT, please ask your doctor to get a serology, that is a hepatitis B and C, done. And if it's positive, you have to take necessary action, because both hepatitis B and C are very, very well controllable. In fact, we are talking of cure nowadays in hepatitis C. That means there is a finite duration of treatment. For hepatitis B, there are very good treatments, probably long term, that is, as of now, you cannot probably stop the treatment. But for hepatitis C, there are finite therapies, like for 3 months, 4 months, you can take 1 or 2 tablets and you will be cured of hepatitis C. But if you don't, that is that if you neglect your disease, then these viruses will kill you. They will colonize or infect your liver and gradually, progressively damage your liver. And ultimately, you might find that you have a jaundice, or you might find that your stomach is getting bloated up, and on a sonography you do a sonography and you find fluid in your abdomen, what in medical terminology or medical jargon we call ascites. So that is a very late stage. Please do not let that late stage to come, because the earlier the detection, the better is the outcome and better is the treatment. So this is for your infective hepatitis. If you have a family history of liver disease, be very careful. There are a lot of liver diseases which are genetically transmitted, and especially Wilson's disease or other rare things. So you have to have a very high index of suspicion for that. If anybody in your family has suffered a liver disease or has died from a liver disease, do consult your doctor, get yourself screened, because you might be carrying those bad genes, unfortunately. So what I tried to summarize is, my take-home message for today's talk is, eat healthy, that is, avoid processed foods, have plenty of natural foods, that is, vegetables, fruits, have fruits rather than fruit juices, because juices have a lot of complex sugars which is difficult to digest. But if you have the fruit, you have the fibers, and which will give you a satiety, which will stimulate your satiety center, so you have a feeling of fullness. So juices are not good, fruits are good. Okay, so natural food like vegetables, fish, chicken, no processed foods, have plenty of fruits, have plenty of curds, because curds are very good for your health. It has a lactobacillus, which is a good bacteria. Then at least have an exercise 5 days in a week for at least half an hour to 45 minutes. It might be a simple walking. So if you are very time pressed, what you can do is, what I advise my patients is, when you come back from your office, get down from the bus at least 2 kilometers before your home and walk down. That will compensate for your walking thing, for your exercise if you don't have time. So you have to have time, you have to create time. And remember, if our Prime Minister and our Chief Minister, they have time to exercise at least 1 hour in a day, I don't think we are more busy than them that we cannot exercise. Both of them are very, very busy person, but they regularly exercise. Remember that. And last but not the least, get a yearly checkup, control your addictions, especially your alcohol and smoking intake, and don't have unsocial drinking. Have social drinking, of course, but not unsocial drinking. And you will have a healthy lifestyle. Thank you.